1 in 10 of our children is diagnosed with ADHD. 1 in 67 is diagnosed with autism. In fact, that number is growing. Back 20, 30 years ago, we had 1 in 10,000, somewhere in that area. But neurobehavioral disorders are in epidemic proportions in the United States today. In fact, I just saw a study last week that came out that showed out of depression and anxiety that 1 in 4 college students is being diagnosed with some level of mental disorder. Even 1 in 5 have admitted to suicidal ideations over the past year. These are frightening numbers. And what's more frightening about them, as I said, is these numbers are growing. The reason why these numbers are growing is because we have a fundamental problem in how we're taking care of these cases. These cases are taken care of as if it's a chemical imbalance. So we're trying to balance the imbalanced chemicals through medications. Problem being is, since it's not getting to the root cause, it does show, in some cases, a short-term benefit. But the long-term studies show that grades do not get better, and the dropout rates, especially for ADHD, does not improve. In fact, if we look at across the spectrum, 32% of our ADHD kids are dropping out of high school. As I said, this is a result of not going after what is fundamentally causing these conditions. These conditions are what we call a disconnection syndrome. There's a brain imbalance. The way the body's formed, or the way the brain is formed, the first 2 to 3 years of life, the right brain is formed much more so than the left brain. And the right brain has to do with our social side. It has to do with our understanding the big picture. It has to do with our relationship building side. It has to do with our EQ, if you will. Our left brain begins building more so in the second and third year of life. And this is where our linear thinking, our logical thinking, our language, and these things appear. Now, when you hear something, you taste something, you see something, or something comes in from any one of your 5 senses, your brain is going to process that. And if you have a balanced brain, if you have a left brain doing its part and a right brain is doing its part, we'll have a balanced perception of what we've seen, and we'll have a balanced response. However, if, for instance, with an ADHD kid, the right brain is weak, when the information comes to them, they get fixated on details. They can't see the big picture. They can't sit still. They have a hard time socially. They don't realize what's socially acceptable, what's socially not acceptable. They don't get the joke. They're more literal. They're not figurative. These are all characteristics of the ADHD, and also some of these characteristics of the autism. Child neurobehavioral disorders is just one aspect we're going to be talking about in this upcoming 8-week online brain examination boot camp. We're also going to be dealing with things like Alzheimer's, dementia, Parkinson's. We're going to talk about depression, anxiety. And really, it's about understanding how to evaluate, how to examine the brain, and how to build protocols with clinical pearls so that you can walk through this, so that you can bring brain-based care into your practice.